Now, because of great and varied efforts by many people, child mortality rates in Papua New Guinea are falling by as much as 20% over the last 10 years. There are many reasons for this. There are many more paediatricians being trained and working in the provinces in rural areas. There's improved vaccine coverage, particularly against measles, and there are new vaccines against pneumonia and meningitis. Vitamin A is being more widely available to treat malnutrition. Mosquito nets are being distributed to fight malaria and dengue fever. More girls are going to school, although still too few. Health is not just about vaccines and medicine. Education saves lives in and by itself. Just by letting a girl in Papua New Guinea complete primary school halves the death rate for her children. A staggering figure, half the death rate if a child finishes primary school. Most of these measures were not in Papua New Guinea 13 years ago, when the mortality rate for children up to 5 years was 10%. A lot of these measures are still not available in many developing countries. Now in Papua New Guinea, the death rate for children up to 5 years is 7.5%, still 10 times higher than what it is in Australia, but this improvement represents the saving of more than 4,000 child deaths per year. So there are some very good stories and reasons for optimism. But much more should be done. There's a great need for better care of pregnant mothers, because now there are more mothers dying in childbirth in Papua New Guinea than there were 10 years before. Improved nutrition would make a dramatic effect on child survival for both mothers and children, particularly from pneumonia and diarrhoea. Now, even more girls need to attend and complete school, and boys. Pneumonia deaths will be further prevented by reducing environmental exposure to smoke and introducing a vaccine that's been available in Australia for our children for many years. The solutions are widely known. They're not very technical. The barrier is implementation. But Pacific governments are working hard to implement such changes. Australia must continue to support these efforts financially and with expertise. As I said, the solutions are not very technical, but they're all about people. By training nurses and doctors and teachers, by building strong communities and encouraging effective policies and responsive, compassionate governments, we can make a real difference for mothers and children in the Pacific. Now, I don't think Australia completes our full obligations to the Convention of the Rights of the Child just by providing these services for the children who live within our national borders, not just for our citizens. As a prosperous, lucky country, we have a moral obligation to assist our neighbours in implementing the Convention of the Rights of the Child and achieving their Millennium Development Goals, because they're our goals as well. I think civil societies in Australia and the Pacific have important roles to play, directly and in demanding more from our governments. There's a saying in Africa that goes, the best time to plant a tree was 20 years ago. The second best time is now. I think such is true for the Convention of the Rights of the Child and for Australia's role in improving child health in the region. Thank you very much.